Well, when we started our pharmacy in 2011, we wanted to offer some of the unique services that are not typically offered by the other pharmacies. So we initially thought of the MTM program, the Medication Therapy Management, which is basically a private meeting between the pharmacist and the patient, one-on-one, and we go over all of their medications, look for drug interactions and things, compliance issues.
So historically, the role of the pharmacist has very much centered around dispensing activities. Time and reimbursement for the pharmacist has been connected to giving a patient a medication or a product. WPQC hopes to transition from that model into a model that will allow the pharmacist to have time to spend with the patient, providing a value-added service.
Actually, my role as a pharmacist today is to help the patient get better. Before, the role was defined differently. The role, usually when a pharmacist speaks about the profession, they want to make sure that the patient is taking the correct medication. You do not do any mistakes, so you're now a good pharmacist.
Most patients don't know how to take their medications, when to take them, which medications should be taken with food, which medications should be taken on an empty stomach. We really need to talk to the doctor about maybe adjusting your glipizide dose to get your blood sugar under control. And by doing that, we are lowering your risk of getting another stroke, and we're also lowering your risk of getting another God forbid, a heart attack.
Yeah.
You don't want that to happen, do you? I don't want that to happen to you either.
We try as pharmacists to suggest to patients medications that we think will be preventive therapy to them. And from these medications are the aspirin therapy. The way I approach it when I see a patient who is not using aspirin, and I think that he needs to be using the aspirin to protect his heart, to protect him from blood clots, I would tell the patient, teach the patient about the aspirin therapy.
And then, do you take any aspirin?
No.
Are you allergic to aspirin?
No.
For people who have diabetes and people who have your condition, especially with a history of a stroke, it might be a good idea to start you on an aspirin. Aspirin has a lot of benefits for people who have, especially with people who have high blood pressure and diabetes. So we'll talk to the doctor, and if it's something he approves, we'll get you started on an aspirin. When we do these medication therapy management or the MTM sessions, we screen for cholesterol medications that are missed, especially with diabetes. A lot of time, patients who are diabetics are not on a statin or a cholesterol medication. We have access to their labs, and we look at their labs, and if we notice that they are borderline or they have higher levels than recommended, we talk to the doctors and we recommend starting a statin usually if they're not allergic to it or if they don't have a contraindication for it.
Giving presentations in the community give us an opportunity to interact more with people. It helps the patient more, providing the patient with information they need about their health conditions. And like let's say for instance, if a patient has hypertension, they're gonna live with that for a long time.
True or false? Medicines will cure high blood pressure. It's false, exactly. It does not cure it, it just controls it.
Pharmacists have a high clinical training, and it only makes sense to apply that to clinical practice. They very much complement the team-based care approach, and they fit very well in with other providers in helping to enhance patient outcomes and decrease healthcare costs. Pharmacists are uniquely positioned to meet with patients at a time that is convenient for the patient to allow for this conversation or this enhanced care to occur. And then they can always circle back with other members of the team with any recommendations they may have or any other suggestions for improvement in the patient's care.
The role of a pharmacist today is to make sure that the patient is getting better. There is better adherence. The numbers, the lab values are getting better because the patient is taking the medication every day. So the clinical services now are really important.
Our 5 locations are inside the inner city. Most of our patients don't even have a high school diploma. Most of our patients don't even have an email. Majority of them don't have access to the internet or to the computers.
Hayat pharmacists are reaching these patients who need these pharmaceutical care services, and they're making a huge difference in their lives.
The mission of the Million Hearts Initiative is to reduce the number of strokes and heart attacks in the United States by 1 million by the year 2017. We can do it. We as pharmacists can definitely help by working locally in our local communities to make this goal achievable. We can make sure that everybody who should be on a blood pressure medication is taking their blood pressure medication every day. We can make sure that everybody who should be on a statin or a cholesterol medication is taking their statin every day. We can make sure that everybody who should be on an aspirin is taking their aspirin every day. As a pharmacist, I can work with my local community to make this goal achievable nationally.
Well, thank you for your time, John. Was this helpful today?
Yeah.
Well, I appreciate your time, John.